right, so we are doing putting the patient on and off of the bedpan. We are doing a stool sample. We will be doing colostomy care, and we will be doing suppository. So my patient has asked for the bedpan, so that's what we are going to do. Normally this would be in the room, not on the table. So knock knock. Good morning, Joanne.
Good morning.
Good morning. My name's Sheena. I'm your student nurse, and I was told you need the bedpan.
Yes, ma'am.
Okay, I would go through all my rights, make sure it's the right resident, especially when doing the stool sample. So I would do hand hygiene, put on my gloves. Okay, Joanne, we are going to be laying you flat. I would of course check to see if that is allowed. You don't want someone who's on a feeding tube to be laid completely flat. Great angle. All right, Joanne. Need a new bed sheets here. Okay, I'm gonna uncover. Joanne, we are going to take the sheets down. You are gonna roll towards Cassie. So we're gonna get you over on your side here. Perfect. I would put a chuck down. Tuck it under, just in case there's any spill. I would. Okay, Joanne, you are going to roll back. Ensure placement. If you'll just come towards me a little bit. Perfect. Great. Now I would sit Joanne up, allow her to do her business, give her a call light, cover her up. High Fowler's position. Now that she has rang and said that she is done with the bathroom, I am going to take Joanne off of the bedpan. So first I'm going to lay my chuck down because we don't want to set anything on any surfaces without a barrier. So Joanne, you're going to go back towards Cassie. I'm going to ensure that I have hold of the bedpan so we don't spill. Perfect. I'm going to place that. I would wipe from front to back to clean Joanne up as needed. Put her new underwear or brief on. Roll back. Come towards me a little bit, Joanne. Perfect. I would then cover her up. Sit her in any position she would like. Give her a call light. And if she needs anything, she can let me know. I would have changed my gloves in between because I would have left the room. Okay. So now I'm going to do a stool sample. Joanne had a bowel movement. I'm going to label this with name, date of birth, room number, doctor's order, and then I would take the Q-tip here and I would poke it into several different locations. And then I would put this in this bag here. Don't forget the time, as well as the specimen container. I would label with the date, room number, name, date of birth, doctor, and the time that the sample was collected. I would take from different locations here, put that there. I would put this in a big brown paper bag and bring it to the lab. Okay, I would change out my gloves, dispose of this properly, cleaning it all out, and sanitizing it, but I'm just going to set it here for video purposes. Okay. In order to not waste gloves, I am back in my med room. I would perform hand hygiene, put gloves on. We are going to get ready to do a suppository. So obviously I wouldn't do this in the med room, but I would check orders in here. Each suppository comes in an individual little package stored in the refrigerator. I would take and put lube in my cup, face down. I would have my patient lay on the left side with the leg up, left lateral laying side. Okay, I'm going to check for rectal reflex, and they have it. So then I would take my suppository and I would insert it following the rectal wall and go up, put your finger in a little bit to ensure that it goes in there and stays. And I would ask the resident to call me or stay in the room if they think that it's going to work right away. So then for colostomy care, I will not waste these gloves. I would do hand hygiene, put on gloves. Resident is called, said that their colostomy was full, or it would be the time to check it. So this would be my colostomy. I would make sure that the stoma is red and beefy. Anything else, I would alert the doctor. There are different placeholders here. You can connect it first if you'd like, and then put it on the resident. You would want to clean the area. Most people have their own cleaning, whether it's a powder, stick adhesive, or a dabber. You would take your measuring tool, you would measure their stoma, and then you would put it up against their stick pad here, and you would cut it out, ensuring that it goes on the right size. You would clasp the end to ensure nothing gets out. Any contents in the bag you would measure and put on their I&O if necessary. Let's see here. I believe that is it. You would wash it, measure, rinse it out if needed, and that is it.